Okay, if you guys watch all of the Hillary Clinton and all of the Donald Trump videos, and now the, I guess I can't really call them independents, the Libertarian and the, what is Evan McMullin? Is he?
He's a true independent.
He's a true independent.
He's not sponsored by anybody.
Dr. Gwain says he's a true independent. Okay, so we're going to talk about these two, probably in less time than either Clinton or Trump. Trump was the shorter of those two. So let's jump to the Libertarian candidate, Johnson Weld. You just go to www.johnsonweld.com, one word for both their names, /issues. And when you click on it, you can see the issues that he wants to address. There's 15 different squares on the web page. I'm looking down at my screen, which is right below the camera here. And what I find is that he does not have one for healthcare. So we can't go by what's on his website, but I can go by what I heard him say in a YouTube of one of his meetings. And in talking about healthcare, what I specifically remember is him saying that by privatizing healthcare and freeing up more of a free market process of people being able to, I believe it was still using insurances, he's going to reduce the cost of healthcare to 1/5 of what it currently is. And I am perfectly comfortable saying that that guy does not understand healthcare and does not know what he's talking about when it comes to healthcare. So you may want to vote for him for other reasons, but don't do it because of his healthcare ideas. I'll just tell you that right now. Okay, so that's Johnson Weld. Moving on to Evan McMullin, the independent. He has at evanmcmullin.com issues. You click on issues and he has, once the web page comes up, a number of issues, including one called healthcare. Clicking on healthcare brings you to another page that is dedicated to what he has to say about healthcare, and we're going to go through it together now. Real healthcare reform means putting patients, families, and doctors at the heart of healthcare. To me, that seems pretty obvious. The Affordable Care Act, parentheses, Obamacare. Obamacare has failed American families, driving up costs and reducing access to quality health care. With costs running into the trillions, Obamacare is also sinking America further into debt while imposing hundreds of billions of dollars of new taxes. By emphasizing competition and innovation instead of government controls, we can build a modern health care system that delivers accessible, affordable, and high-quality care. We can also protect vulnerable populations, including patients with pre-existing conditions. Real health care reform means putting patients, families, and doctors first. Obamacare has proven incapable of controlling the growth of healthcare costs, which take an increasing cut out of workers' paychecks or even force them to give up insurance. Major insurers are pulling out of Obamacare exchanges because the program is so poorly designed and so full of complex regulations that the insurance companies are losing money despite vast federal subsidies. The cost of those subsidies will be $1.2 trillion over the next 10 years, or an average of $120 billion per year. The program will also impose more than $200 billion in penalties on workers and employers, and still 33 million Americans won't have health insurance. We must repeal Obamacare as soon as possible, replacing it with a more streamlined, pro-market approach to insurance. The few positive elements of Obamacare, such as guaranteed coverage for pre-existing conditions, could easily be incorporated into a new program in a much more efficient manner. Okay, that's what I was looking for with Donald J. Trump's plan, and I couldn't find was, yes, we're keeping pre-existing conditions, protection against pre-existing conditions. He's not specifically mentioning gender equality. I hope that would also be a part of it. Something else I haven't brought up yet is how much I have enjoyed with the Affordable Care Act that preventive services are paid for without having a deductible or a copay. So preventive visits annually come in, patients come in, we're able to go through a list of things that should be reviewed on an annual basis, we say. You know, some things aren't annual, like colonoscopies for people over age 50 or every 10 years, unless they have reasons to do it earlier. PAPs every 3 or 5 years, depending on if they're getting HPVs checked also, as long as they're normal. But we check every year to see, are you up to date on this? We check their blood pressure every year. We check their vital signs and their weight and their BMI every year and see how things are going. There's some labs we check depending on certain health conditions they may have. Their screenings, things that we really like to have the patients come in. And now, does everybody need to come in every year? No. About age 50 is when I think, yeah, let's come in every year. But if someone's perfectly healthy, has nothing going on, yeah, if you're in your 40s and you're absolutely fine, we don't have any health conditions, come in every other year. But I really like that currently it's covered for every year. I really like that all the immunizations are covered because they help us to be able to get people to be protected against illness that they otherwise would be vulnerable to. But I do recognize that having it through some kind of insurance plan or health plan means that it's going to cost more money than if they actually did pay cash from the patient to the doctor, having that middleman there. So when you talk about free market, having it go through the insurance is going to cause a problem with the dream of some kind of a supply and demand sensitive system. Okay, let's get back to it. The heart of Obamacare replacement should be a tax credit for every household that does not have insurance through an employer. Instead of the government defining a long list of benefits every insurance plan must have, which I actually liked, customers should be able to tell insurance companies what they want. I believe in this age of technology, you could probably have a website where you have a menu system and you select what you want. I will tell you that is not the way of insurance companies currently, at least when it comes to health plans. This will spur competition and ensure that the tax credit is sufficient to purchase any number of different plans. Allowing the purchase of insurance across state lines would also increase competition and bring down costs. We heard that also in the Donald Trump plan. Finally, encouraging the use of health savings accounts will help create more educated consumers who seek treatment from efficient and high quality providers. Interesting, the high quality, that's actually something that's in place now, is tracking what's going on in doctors' offices with outcomes to find out actually who is providing high quality. It's kind of a nice thing for those of us who provide good care because our numbers look good and people can see, hey, we keep patients out of the hospital better and we keep their blood pressure better controlled and their blood sugars better controlled when they have problems with that. That is usually through some kind of government regulation that's happening if it's going to be in a standardized way. I suppose insurances could all have their own individual way of doing it, and I will just be in absolute misery if each insurance company has its own way of measuring how good the care is that we're delivering here. I really don't want that situation. I would prefer to have one source and have that be a federal government source measuring our performance. Okay, this will spur competition and ensure that the tax credit is sufficient to purchase any number of different plans. Allowing the purchase of insurance across state lines would also increase competition, bring down costs. I'm sorry, I already read that. Strengthening Medicare. Medicare plays an indispensable role in providing health care for America's senior citizens. It must be put on a sound financial footing so that all Americans have access to high quality care in their retirement years. The only way to preserve Medicare for the next generation is to get hold of runaway costs that threaten the program's viability while spurring massive growth of the federal debt and deficit. Established 50 years ago, Medicare hasn't adapted to an aging population with a rising life expectancy. Instead of covering 1 in 10 Americans, the program now covers 1 in 6, or 50 million men and women, more women, who spend close to 20 years as Medicare patients, up from just 15. At the same time, relentless inflation in medical costs has led the cost of coverage to triple. Whereas payroll taxes and premiums once covered 70% of costs, the government now spends $700 billion per year while collecting only $100 billion from Medicare payroll taxes. Without reform, Medicare and other entitlements will push our government to the edge of bankruptcy. Donald Trump and Hillary Clinton have made clear they have no appetite for reform, only for more spending. However, Evan McMullin is not afraid to challenge the status quo in order to put Medicare on a sound footing for the future. The way to reform Medicare is encourage competition and innovation by putting patients, families, and doctors first. The key to reform is premium support, a system in which all beneficiaries would receive a uniform subsidy toward the purchase of coverage from competing health plans, including the option of traditional Medicare. This approach would give seniors greater freedom to choose the plan that best suits their needs, while spurring competition among plans to provide the best quality care at the most efficient price. This scares me, and I'll tell you why. Even though he's right, the Medicare costs have been going up, if we look at the non-Medicare world with all of the health plans and what's been going on where supposedly they had competition, costs didn't do any better. I'm afraid that it would actually be worse to do that, just because of what I've seen. I understand on principle, a lot of people like the idea of having a free market, but again, I tell you, this is not a free market when it comes to healthcare. Free market is, I'll pay you $1 for that carton of milk and you take it. Healthcare is not that. Healthcare is you go to the doctor, you have no idea what it's going to cost, they don't know what the insurance is being charged. Even if they see the numbers, it's not what's really going on because there's different numbers. Not my fault. It was here before I got into medicine. I was just a kid. Okay. To promote informed decision-making by beneficiaries, the federal government must develop and distribute user-friendly publications that enable beneficiaries to compare plans, estimate out-of-pocket costs, and assess the quality of competing providers. I can just tell you that's not going to work. By making informed decisions, beneficiaries can encourage a cycle of competition and innovation that leads to better outcomes for all. Improving Medicaid. Medicaid's purpose is to provide lower-income Americans with the health care they need but can rarely afford. Despite its tremendous cost, there is little evidence that Medicaid is actually improving the overall health of the citizens it insures. Did you hear that?
I did hear that.
Little evidence Medicare. Now, earlier there was a quote in one of the other statements that it was Donald Trump's that said that Medicaid had worse health outcomes and higher death rates. And my argument was that might not be an issue of causation. It might be the population they're working with. Mm-hmm. You've worked in these places, the Medicaid system.
Yep.
Do you think it's the system that's the problem, that they're actually not getting health improvement for people, or is it just a harder population to serve to start with?
Probably a little bit of both.
He thinks it's a little bit of both. He knows, he's been in there. Okay, when it was first established in 1966, Medicaid covered just 2% of the population. Today it covers more than 20%, almost 70 million men, women, and children. Obamacare alone has pushed 12 million individuals onto Medicaid. The annual cost of the program has risen to $550 billion, an increase of $200 billion under President Obama. The cost per beneficiary has also risen sharply to more than $7,000 per year. Along with other entitlements, Medicaid is pushing our government to the edge of bankruptcy. Nonetheless, Donald Trump and Hillary Clinton have no appetite for reform. Yet voters have a choice because Evan McMullin is prepared to demand accountability from Medicaid in order to bring costs under control while delivering better health outcomes for Medicaid patients. Despite having a different purpose than Medicare, Medicaid would also benefit from reforms that emphasize competition and innovation while putting patients, families, and doctors first. Currently, individual states rely on federal matching funds for Medicaid. This leads to inefficiency because the system rewards states for spending more instead of spending more wisely. And of course, a philosophical issue I've always had is, why do the states pay all this money to the federal government to have it given back to the states? I know that's not a problem I'm going to solve. Instead, there should be a cap on federal support. This can be accomplished by giving states block grants instead, and you heard that from Donald Trump, instead of federal matching funds, or by giving states a fixed dollar amount for each individual enrolled in Medicaid. The advantage of the latter is that in the event of an unexpected increase in enrollment because of a recession, for example, states will be able to handle the change. This would be complemented by paring back the extensive restrictions that Washington places on state Medicaid programs, which discourage innovation and prevent states from taking full responsibility for outcomes. Medicaid could also become far more responsive to patient needs by creating a separate program for disabled and elderly recipients whose needs are far different from able-bodied adults and their children. Does he not know about Medicare? You see, Medicare is for people once they reach age 65, but it's also for the disabled. And so in many states, you'll have what we call Medi-Medi. You have both Medicaid and Medicare. And between the two of them, you get more health care paid for than if you had either one by itself. Together, these changes provide a promising way to increase the accessibility of health care to Medicaid recipients. Right now, many doctors refuse to accept Medicaid patients because reimbursement rates are so low. That's actually not the only reason, but that is a very good reason, because it's essentially, oh, Medicaid patient, please come into my office. Here, let me give you $1 for coming in. That's how little it reimburses. Okay, maybe not $1. Together, these changes are promising to increase the accessibility of healthcare to Medicaid recipients. Right now, many doctors refuse to accept Medicaid patients because the reimbursement rates are so low. These reforms point the way toward ensuring that Medicaid patients become valued customers, not second-class citizens. There's a lot of truth to that. When your regular doctors can't afford to see the patients with a certain insurance, they end up going to, like for our area, the county clinic. And it is a different kind of care. Dr. Gwain worked there. He was very glad to get full-time with us and stop working there. There's just something about that environment. And I don't like seeing patients that we used to have who had insurance, who got Affordable Care Act plans, and then it turned out to be Medicaid because of expanded Medicaid. And they got it without even knowing it because the broker who sold it to them may not have even known it, or if they did know it, they deceived the person buying the insurance, told them, oh yeah, you can see a regular doctor. No, we're not contracted with Medicaid in our state, Medi-Cal. And so they're no longer able to come to our office. And it's because if I contract with that payer, I'm going to be paid less than it costs me to provide the service. And I need to be paid more than it costs me to provide the service in order to make a profit as a private business. So that's Gary Johnson and Evan McMullin. If you haven't seen the Hillary Clinton, I'll warn you, it's like 36 minutes long, or the Donald Trump, those are other plans in the playlist. And if you have an awful lot of time to watch me talk about these plans, go ahead, knock yourself out. If you have comments about it, go ahead and comment below. I apologize for it being so long, but these people wrote an awful lot about healthcare reform. Thank you so much for your patience and for trusting my opinion in going over these plans with you. I hope that it's been helpful for you to make your own decision. My goal was not to make your decision for you. We all have our own opinions when it comes to politics. I just wanted to give you a doctor's read-through of the statements from the various candidates. Thanks again.